I couldn't walk up a flight of stairs without huffing and puffing. I couldn't walk more than about 1/8 of a mile without huffing and puffing. I mean, I just couldn't do much physically.
Mike Barron first noticed a burning sensation in his chest, but symptoms got worse. Then doctors found that his aortic valve was failing and would need to be replaced. That's when Barron was presented with a choice he wasn't expecting.
Just open heart surgery, replace the valve, put you back together, and move on. He said there's a thing called Tavr, which they go basically through your groin up through and replace it that way.
Tavr, short for transcatheter aortic valve replacement, uses a catheter-based approach to replacing the valve. Surgeons put a small incision in the femoral artery and insert a small tube. The artificial valve is threaded into the tube and directed through the body to be placed in the aortic valve.
Well, I thought, I'm not real crazy about having my chest open, so I started looking into the Tavr more, and come to find out, wasn't going to get it through Medicare.
Tavr has been around for a decade, typically available only to patients who were too sick to undergo heart surgery. Barron didn't qualify, but his daughter, a registered nurse, found a Tavr trial at the University of Washington, where doctors are looking at how lower-risk patients could benefit.
Over and over again, what they have suggested is that a minimally invasive approach to replacing the aortic valve is at least as good as, if not better than, open heart surgery.
Dr. Jamie McCabe, medical director of the cardiac cath lab at UW, says the Tavr procedure can be done in about 25 minutes, with patients leaving the hospital the very next day. And while the minimally invasive surgery has its benefits, Dr. McCabe explains the key factor in this trial.
The reason that this trial exists at all is because we want to follow people for quite a while to make sure that these valves are durable, that they last as long as we expect them to.
Mike Barron did qualify for the UW trial, though he had a 50-50 shot of getting Tavr versus open heart surgery. In the end, doctors used Tavr on Barron, and he couldn't be more pleased.
1:30 Friday afternoon, I left the hospital. Went home, caught up on sleep. Saturday, didn't do a whole lot. Sunday, I walked around the yard. Monday, I walked about 3/4 of a mile. Wednesday, I mowed the lawn.
Researchers at the University of Washington are looking for more patients for this trial. There are a lot of hoops to jump through to see if you qualify, and it's best to start by asking your doctor. We've got a link to this trial on our website, king5.com. Just click on HealthLink.